Question 1. A pharmaceutical company conducts a clinical trial to test the efficacy of a new pain reliever for individuals with chronic back pain. The trial is randomized and double-blinded, and the results show that the drug significantly reduces pain compared to the placebo. However, there is a high dropout rate, particularly among participants in the treatment group who report worsening pain or side effects. How should the researchers handle this issue? Their analysis. A. They should exclude the dropouts from the analysis to maintain the integrity of the results. B. They should conduct an intention to treat analysis including all participants regardless of whether they completed the study to account for the impact of dropouts. C. They should only analyze the data from participants who experienced no side effects. D. They should conduct a post hoc analysis that focuses only on the participants who completed the study. Answer. B. They should conduct an intention to treat analysis including all participants regardless of whether they completed the study to account for the impact of dropouts. Explanation. In clinical trials, an intention to treat analysis is essential because it includes all participants who were initially assigned to each treatment group, even if they drop out or do not complete the study. This approach helps minimize bias and provides a more estimate of the treatment's real-world effectiveness. Excluding dropouts could lead to biased results, as those who drop out may have different characteristics than those who remain in the study. Focusing on participants who experienced no side effects would ignore the experiences of a significant portion of the sample, undermining the study's external validity. Question 2. Mr. David is an epidemiologist investigating a recent outbreak of salmonella. He gathers data from hospitals, performs interviews with affected individuals, and attempts to identify the source of the infection. In his analysis, he realizes that certain groups of people, such as children and elderly individuals, were disproportionately affected. Which of the following epidemiological terms best describes this phenomenon? A. Surveillance bias. B. Selection bias. C. Information bias. D. Confounding. Answer. B. Selection bias. Explanation. In an outbreak investigation, selection bias occurs when certain groups of people are more likely to be included in the study than others, which can distort the results. In Mr. David's case, the fact that children and elderly individuals are disproportionately affected suggests that the way individuals were selected for inclusion in the study may have introduced bias. This could be due to their greater susceptibility to salmonella or more frequent visits to the hospital. Selection bias can lead to inaccurate conclusions about the general population's risk. Surveillance bias occurs when surveillance efforts disproportionately capture certain cases, such as more severe cases, leading to a skewed understanding of disease frequency. Information bias arises from errors in how data is collected, such as inaccuracies in reporting. Confounding happens when an external factor affects both the exposure and outcome, making the relationship between the two appear different than it actually is. Question 3. A study was conducted to evaluate the impact of a new hypertension drug. Participants were randomly assigned to receive either the new drug or a placebo. After 6 months, the results showed that the new drug group had significantly low blood pressure compared to the placebo group. However, further analysis revealed that individuals in the drug group were also more likely to engage in physical activity compared to those in the placebo group. This difference in physical activity may have influenced the blood pressure outcomes. What type of bias or confounding effect should be considered in this analysis? A. Recall bias. B. Confounding bias. C. Randomization bias. D. Information bias. Answer. B. Confounding bias. Explanation. Confounding bias occurs when an extraneous variable, in this case physical activity, is associated with both the exposure, taking the new drug, and the outcome, blood pressure, potentially distorting the observed relationship between the two. In this study, physical activity is a confounder because it is likely to affect blood pressure and is not evenly distributed between the two groups. Since participants in the drug were more physically active, this could explain some of the observed difference in blood pressure outcomes. Proper control of confounding, e.g., adjusting for physical activity in the analysis, is crucial to obtain valid results. Recall bias occurs when participants do not remember or report exposure information accurately, which is not relevant here. Randomization bias would occur if randomization did not happen properly, but the study indicates random. Simon. Information bias refers to systematic errors in data collection, such as measurement errors, which does not apply in this case. Question 4. Dr. Smith is conducting a cross-sectional study to determine the prevalence of diabetes among adults aged 50 and older in a large metropolitan city. The study surveys a random sample of 1,500 individuals, asking them about their medical history, lifestyle, and diabetes diagnosis. While analyzing the data, Dr. Smith notices that individuals who are more likely to respond to the survey are those who have a chronic health condition. Which type of bias is Dr. Smith most likely encountering, and how could this bias affect the study's findings? A selection bias. This could lead to an overestimation of diabetes prevalence because those with chronic health conditions may be more likely to respond. B. Information bias. This could result from errors in how diabetes status is reported or remembered by participants. C. Recall bias. This could occur if participants with diabetes remember their condition more accurately than those without. D. Confounding bias. This could arise if another factor, age, is related to both diabetes and survey participation. And so a selection bias. This could lead to an overestimation of diabetes prevalence because those with chronic health conditions may be more likely to respond. Explanation. Selection bias occurs when the participants in a study are not representative of the population from which they are drawn. In this case, Dr. Smith's study might suffer from selection bias because individuals with chronic health conditions, such as diabetes, may be more likely to respond to the survey. As a result, the sample overrepresents individuals with diabetes and may lead to an overestimation of the disease's prevalence. To control for this bias, Dr. Smith could consider adjusting for chronic health conditions in the analysis or using a more comprehensive sampling method to ensure a representative population. Question 5. A group of researchers investigates the association between a high sugar diet and the development of type 2 diabetes. They find that individuals who consume more sugar have a higher risk of developing diabetes, but they are concerned about the possibility of reverse causality. What is reverse causality, and how can the researchers address this concern in their study? A reverse causality occurs when the cause is mistakenly thought to be the effect. The researchers can address this by conducting a randomized controlled trial, RET, to establish causality. B. Reverse causality occurs when diabetes causes individuals to crave more sugar. The researchers can address this by using the cross-sectional study design. C. Reverse causality occurs when the effect is mistakenly thought to be the cause. The researchers can address this by for potential confounders in a cohort study. D. Reverse causality occurs when diabetes leads to a high sugar diet. The researchers can address this by using a longitudinal study design to establish temporal relationships. And so a reverse causality occurs when the cause is mistakenly thought to be the effect. The researchers can address this by conducting a randomized controlled trial RET to establish causality. Explanation. Reverse causality occurs when the effect, in this case diabetes, is mistakenly thought to be the cause of the observed association, high sugar intake. This is a concern in observational studies where researchers cannot establish temporal relationships. Conducting randomized controlled trial RET would help establish causality by directly manipulating the exposure sugar intake and observing the effects over time. Longitudinal studies could also be useful, but RETs are the gold standard for establishing causality. Question 6. Dr. Johnson is analyzing the results of a case-controlled study investigating the relationship between alcohol consumption and liver cancer. In the study, 500 liver cancer patients' cases and 1,000 healthy individuals, controls, were asked about their alcohol consumption history. Dr. Johnson notices that people with liver cancer tend to remember and report their alcohol consumption more accurately than those without cancer. What type of bias is likely affecting the study's results, and how can Dr. Johnson mitigate this bias in future studies? A. Recall bias. This could lead to an overestimation of the association between alcohol consumption and liver cancer. B. Selection bias. This could occur if the controls were not properly selected from the general population. C. Information bias. This could result from incorrect reporting of alcohol consumption by either group. D. Confounding bias. This could occur if an external factor, such as age, is influencing both alcohol consumption and cancer risk. Answer A. Recall bias. So this could lead to an overestimation of the association between alcohol consumption and liver cancer. Explanation. Recall bias occurs when there is differential accuracy in the recall of exposure information between cases and controls. In this case, individuals with liver cancer may be more likely to remember and report their alcohol consumption either because of their diagnosis or due to increased awareness of the risk factors. Lead to an overestimation of the association between alcohol consumption and liver cancer. Dr. Johnson can mitigate recall bias by using objective measures of alcohol consumption, such as medical records or biomarkers, to avoid relying on participant recall. Question 7. Dr. Harris is conducting a randomized clinical trial to test the efficacy of a new drug in reducing the incidence of heart attacks. The study includes two groups. One group receives the drug and the other receives a placebo. However, halfway through the study, a significant portion of participants in both groups drop out, and some of those who remain in the study switch their assigned treatment. Which type of bias is most likely to affect the validity of Dr. Harris's findings, and how can this bias be addressed? A. Randomization bias. This occurs because the randomization process failed to create comparable groups. B. Attrition bias. This occurs due to the dropout of participants, which could affect the comparability of the groups. C. Information bias. This arises from incorrect data collection or reporting errors. D. Confounding bias. This occurs when an external factor influences both the treatment and the outcome. Answer B. Attrition bias. So this occurs due to the dropout of participants, which could affect the comparability of the groups. Explanation. Attrition bias arises when participants drop out or are lost to follow-up in a study, which can affect the comparability of the treatment and control groups. If individuals who drop out or switch treatment differ systematically from those who remain in the study, the results may no longer be valid or generalizable. Dr. Harris can minimize attrition bias by using intention to treat analysis, which includes all participants in the group to which they were originally assigned, regardless of whether they completed the treatment or not. Question 8. In a study assessing the effect of air pollution on respiratory diseases, researchers use a Poisson regression model to analyze the data. The study finds that for every 10 mgm increase in particulate matter, the incidence rate of asthma increases by 0.25 cases per 100,000 individuals. What is the key advantage of using Poisson regression in this type of study, and how should the researchers interpret this? A. Poisson regression allows for the estimation of relative risks, which is appropriate for this type of count data. B. Poisson regression adjusts for confounding variables, making it less susceptible to bias. C. Poisson regression is only suitable for studies with categorical outcomes. D. Poisson regression is useful for modeling time-to-event data, which is not applicable in this study. A. Poisson regression allows for the estimation of relative risks, which is appropriate for this type of count data. Explanation. Poisson regression is often used for modeling count data, particularly when the outcome is the number of events, such as asthma cases, occurring in a fixed time or space. It is especially appropriate for situations where the data is rare or the events are independent. The Poisson regression model estimates the rate ratio, a relative risk in this context. The interpretation of the result indicates that a 10 mgm increase in particulate matter is associated with 0.25 increase in asthma cases per 100,000 individuals. Poisson regression does not directly adjust for confounding unless specified in the model. It is suitable for count data, not categorical data. It is not primarily used for time-to-event data. The survival analysis methods would be more appropriate in such cases. Question 9. Dr. Lee is conducting a meta-analysis of several studies on the relationship between dietary salt intake and hypertension. In her analysis, she combines studies of different designs, including cohort studies, case control studies, and randomized trials. Which of the following is the primary concern with Dr. Lee's approach, and how should she address this issue? A. The inclusion of studies with different designs can introduce heterogeneity, which may complicate the interpretation of the pooled effect size. B. Randomized trials should be excluded because they are inherently less reliable than observational studies. C. The pooling of studies with varying sample sizes may lead to statistical power issues, making the results unreliable. D. Case control studies should be excluded because they cannot provide information on risk factors like cohort studies. Answer A. The inclusion of studies with different designs can introduce heterogeneity, which may complicate the interpretation of the pooled effect size. Explanation. When conducting a meta-analysis, it is crucial to consider the design of the included studies. Combining studies with different designs, such as cohort studies, case control studies, and randomized trials, can introduce heterogeneity, which refers to the variation in the results of studies. This heterogeneity can complicate the interpretation of the pooled effect size, as the studies may have different biases, participant characteristics, or methodological approaches. To address this, Dr. Lee could perform subgroup analysis to examine the results within each study design type or use statistical techniques, such as random effects models, to account for the variability between studies. This would help her to better interpret the combined results while taking into consideration the differences in study designs. Excluding randomized trials would be inappropriate because they are generally considered the gold standard in epidemiological research, especially for estimating causal effects. Pooling studies with different sample sizes could affect the precision of the results, but this is generally addressed by the meta-analysis weighting each study by its sample size or statistical power. Excluding case controls is unnecessary, as they can provide valuable insights, especially in rare diseases or conditions where cohort studies might be impractical. Question 10. A team of researchers is evaluating the impact of a smoking cessation program on lung cancer rates. They compare lung cancer rates between two groups. One group receives the smoking cessation program and the other group receives usual care. After a 5-year follow-up, the group receiving the smoking cessation program shows a significantly low rate of lung cancer. However, the researchers are concerned about whether the result can be generalized to the broader population. Which type of validity is most relevant to this concern, and what can the researchers do to improve it? A. External validity. They can improve it by ensuring that the study sample is representative of the broader population. B. Internal validity. They can improve it by minimizing biases such as selection or information bias. C. Construct validity. They can improve it by ensuring that the smoking cessation program is a true representation of the concept of smoking cessation. D. Statistical conclusion validity. They can improve it by ensuring statistical tests used are appropriate for the data. Answer A. External validity. They can improve it by ensuring that the study sample is representative of the broader population. Explanation. External validity refers to the extent to which the results of a study can be generalized to a broader population beyond the sample studied. In this case, the researchers are concerned about whether the results of the smoking cessation program can be applied to the general population. To improve external validity, could ensure that the study sample is representative of the broader population, for instance by recruiting participants from diverse demographics and geographical areas, or by ensuring the study includes various subgroups. Internal validity is related to the study's ability to establish a causal relationship, which is crucial but doesn't address generalizability. Construct validity involves the accurate measurement of the concept being studied but is not primary concern here. Statistical conclusion validity focuses on the correct use of statistical methods, which is important but does not directly address the generalizability issue. Question 11. Dr. Mark is conducting a cohort study to investigate the relationship between air pollution and respiratory diseases in a large urban population. He collects data from two groups of participants, those who live in high pollution areas and those who live in low pollution areas. Over a period of 10 years, he observes the incidence of chronic obstructive pulmonary disease (COPD) in both groups. However, Dr. Mark notices that the groups differ not only in terms of air pollution, but also in several important factors such as socioeconomic status, diet, and exercise levels. What potential issues is Dr. Mark facing, and what methods can he use to control it? A. Confounding. Dr. Mark can use stratification or multivariable regression to adjust for confounders. B. Selection bias. Dr. Mark can use randomization to eliminate selection bias. C. Information bias. Dr. Mark can use objective measures instead of self-reported data to reduce information bias. D. Measurement error. Dr. Mark can use multiple sources of data to correct for measurement errors. Answer A. Confounding. Dr. Mark can use stratification or multivariable regression to adjust for confounders. Explanation. The potential issue Dr. Mark is facing is confounding, which occurs when a third variable, e.g., socioeconomic status, diet, or exercise, is associated with both the exposure air pollution and the outcome COPD, leading to a distortion of the true relationship between the exposure and the outcome. Dr. Ma. Control for confounding by using stratification, analyzing the groups based on confounding variables or multivariable regression, adjusting for confounders in the analysis. Selection bias would occur if participants were not randomly assigned to high or low pollution areas. Randomization is not possible in this observational study. Information bias refers to errors in data collection, which is not the primary concern in this scenario. Measurement error could affect the accuracy of data, but is not the focus of this question. Question 12. A public health agency is investigating the spread of an infectious disease in a community. The disease appears to have a high incidence rate in certain neighborhoods, and the agency decides to use a cross-sectional study designed to assess the relationship between various risk factors, e.g., age, sex, vaccination status, and disease prevalence. Which of the following is a limitation of using a cross-sectional study in this situation, and how can the researchers mitigate it? A. It cannot establish causality. Researchers should use a cohort study to establish temporal relationships. B. It may lead to information bias. Researchers should use random sampling to minimize bias. C. It may suffer from selection bias. Researchers should ensure the study sample is representative of the general population. D. It does not allow for statistical analysis. Researchers should use statistical modeling to test associations. Answer A. Cannot establish causality. Researchers should use a cohort study to establish temporal relationships. Explanation. A cross-sectional study examines the association between exposures and outcomes at a single point in time, making it difficult to establish cause and effect relationships. While it can help identify associations, it cannot establish whether the exposure preceded the outcome. It lacks temporal sequencing to establish causality. The researchers would need to use a cohort study which follows participants over time to observe the development of the disease. Information bias may occur if the data is inaccurate, but this is not a primary limitation in the context of this question. Selection bias can be a concern in any study design, but it is not the main limitation in this scenario. Cross-sectional studies do allow for statistical analysis, so statistical modeling is not the main issue. Question 13. Dr. Emma is analyzing the data from a randomized controlled trial (RET) on the effectiveness of a new drug for reducing the incidence of heart disease. The trial includes two groups, one receiving the drug and one receiving a placebo. After the trial, Dr. Emma performs a statistical analysis and finds that the p-value is 0.3. She concludes that the drug is effective at reducing heart disease incidence. What potential issue should Dr. Emma consider before making this conclusion? A. Type I error. Dr. Emma should consider adjusting for multiple comparisons to reduce the risk of a false positive. B. Type error. Dr. Emma should increase the sample size to ensure sufficient power for detecting an effect. C. Confounding. Dr. Emma should adjust for confounders using multivariable analysis. D. Measurement bias. Dr. Emma should use more precise tools to measure the incidence of heart disease. Answer A. Type I error. Dr. Emma should consider adjusting for multiple comparisons to reduce the risk of a false positive. Explanation. A type I error occurs when a researcher incorrectly rejects a true null hypothesis. It concludes that an effect exists when it does not. The p-value of 0.3 indicates statistical significance, but Dr. Emma must be cautious about making this conclusion without addressing the possibility of multiple comparisons, which can inflate the likelihood of finding a false positive. To reduce the risk of a type I error, she can adjust for multiple comparisons using techniques like the Bonferroni correction or false discovery. Control. That Pomentura refers to failing to detect a true effect, but the p-value already suggests that an effect may exist. So this is not the main concern. Confounding could distort the observed relationship, but the study design, randomized controlled trial, should control for confounders through randomization. Measurement bias could affect the accuracy of heart disease incidence measurements, but this is less likely in a well-designed area. Question 14. A cohort study is being conducted to evaluate the association between physical activity and the risk of developing diabetes in a middle-aged population. The researchers find that the relative risk RR for diabetes among those with high physical activity is 0.5 compared to those with low physical activity. What does this relative risk suggest about the relationship between physical activity and diabetes, and should the researchers do next? A physical activity is associated with a reduced risk of diabetes. The researchers should report the confidence interval and perform statistical significance testing. B. Physical activity has no association with diabetes. The researchers should conduct a case control study to confirm the results. C. Physical activity increases the risk of diabetes. The researchers should reconsider the study design. D. The study did not measure the correct outcome. Researchers should conduct a cross-sectional study instead. Answer A. Physical activity is associated with a reduced risk of diabetes. The researchers should report the confidence interval and perform statistical significance testing. Explanation. A relative risk RI of 0.5 suggests that physical activity is associated with a 50% reduction in the risk of developing diabetes for individuals with high physical activity compared to those with low physical activity. This finding implies physical activity is beneficial in preventing diabetes. The next step for the researchers would be to report the confidence interval psi to indicate the precision of the RR estimate and perform statistical significance testing to determine whether the observed association is likely to be real or due to chance. Case control studies are typically used for studying rare outcomes, but cohort studies are appropriate for examining the relationship between activity and diabetes. The finding suggests a protective effect of physical activity, not an increased risk. The study appears to be measuring the correct outcome, diabetes, and a cross-sectional study is not necessary. Question 15. A researcher is conducting an epidemiological study to examine the relationship between alcohol consumption and liver cancer. They find that the odds ratio, or for the association between heavy alcohol consumption and liver cancer, is 3.0. What does this odds ratio suggest, and what should the researcher consider when interpreting this result? A. Heavy alcohol consumption is 3 times more likely to lead to liver cancer. The researcher should adjust for potential confounders. B. Heavy alcohol consumption has no effect on liver cancer. The researcher should consider performing a cohort study instead. C. The study may have biased results. The researcher should use a cross-sectional study to eliminate bias. D. Heavy alcohol consumption is protective against liver cancer. The researcher should recon the study hypothesis. Answer A. Heavy alcohol consumption is 3 times more likely to lead to liver cancer. The researcher should adjust for potential confounders. Explanation. An odds ratio of 3.0 suggests that individuals who engage in heavy alcohol consumption are 3 times more likely to develop liver cancer compared to those who do not consume alcohol heavily. The researcher should be cautious of potential confounders that could distort the relationship and may need to adjust for them using methods such as multivariable regression or stratification. The cohort study design would be useful for examining causal relationships, but is not necessary here to interpret the odds ratio. A cross-sectional study might be prone to biases like recall bias and cannot establish causal links, which makes it an inappropriate solution for this study design. The odds ratio suggests a harmful of alcohol consumption, not a protective effect. Question 16. A public health team is conducting a study to assess the association between exposure to a particular pesticide and the incidence of skin cancer. They use a case control study design and find that the odds ratio, or for the association, is 2.5. What does this suggest, and what further analysis should the researchers conduct to ensure the robustness of their findings? A. Pesticide exposure is associated with a 2.5-fold increase in the odds of developing skin cancer. The researchers should conduct stratified analysis to examine potential effect modifiers. B. Pesticide exposure has no impact on skin cancer risk. The researchers should use a cohort study to confirm the results. C. The study may suffer from information bias. The researchers should rely on objective data sources for exposure assessment. D. The study has high internal validity. The researchers should perform a different type of study design to confirm these findings. Answer A. Pesticide exposure is associated with a 2.5-fold increase in the odds of developing skin cancer. The researchers should conduct stratified analysis to examine potential effect modifiers. Explanation. An odds ratio of 2.5 suggests that pesticide exposure is associated with a 2.5-fold increase in the odds of developing skin cancer. To confirm and deepen the analysis, the researchers should perform analysis to determine if certain factors such as age, sex, or occupation modify the effect of pesticide exposure on skin cancer risk. This helps identify if the association varies across different subgroups. This is known as examining effect modification. Cohort study designs are useful for establishing causality, but since this is a case control study, the association can be established without needing to confirm the results with a cohort. Information bias may occur if exposure data is incorrectly assessed, but the odds ratio itself does not suggest this was a primary issue in this case. The study does not necessarily have high internal validity yet, as there could be confounders or biases present. Stratified analysis can help improve the robustness of the findings. Question 17. In a randomized controlled trial RET investigating the effect of a new hypertension drug on blood pressure, the researchers observed that the treatment group has a statistically significant reduction in blood pressure compared to the placebo group. However, several participants in the treatment group dropped out before the study ended. What issue may arise from this dropout, and what strategy should the researchers use to address this problem? Attrition bias. The researchers should perform intention to treat analysis to account for dropouts. B. Detection bias. The researchers should use objective measurements for blood pressure to minimize bias. C. Sampling bias. The researchers should recruit more participants to improve the sample size. D. Confounding bias. The researchers should control for confounders using multivariable analysis. Answer A. Attrition bias. The researchers should perform intention to treat analysis to account for dropouts. Explanation. Attrition bias occurs when participants drop out of the study, leading to a loss of data that may differ systematically from the participants who remain. This can distort the study's findings. To address this, the researchers should use intention to treat the analysis, which includes all participants in the analysis regardless of whether they complete the study, to preserve the randomization and minimize the bias caused by dropouts. Detection bias refers to errors in how outcomes are measured, but this is not the main issue here. Sampling bias refers to issues in how participants are selected, but the problem in this study is related to attrition, not selection. Confounding bias could occur if other variables affect the outcome, but it is not the primary concern when dealing with dropouts. Question 18. Dr. Susan is conducting a study to assess the effectiveness of a new vaccine in preventing a certain infectious disease. She finds that the vaccine has a high efficacy in preventing the disease in participants aged 1830, but is less effective in participants over the age of 60. Which of the following should Dr. Susan consider when interpreting these results? A. The vaccine may be less effective in older adults due to immune system changes with aging. She should analyze the data by age groups. B. The vaccine is equally effective across all age groups. She should perform a subgroup analysis to identify any age-related differences. C. The vaccine may cause harm in older adults. She should stop the trial for this age group. D. The study results may be biased due to participant selection. Should use random sampling to ensure representativeness. Answer A. The vaccine may be less effective in older adults due to immune system changes with aging. She should analyze the data by age groups. Explanation. The vaccine's reduced effectiveness in older adults could be related to changes in the immune system that occur with aging, making older individuals less responsive to vaccination. To better understand these differences, Dr. Susan should conduct an age-stratified analysis to examine the vaccine effectiveness in different age groups. This approach will allow her to better interpret the results and identify any variations in efficacy across age groups. Subgroup analysis is actually part of age-stratified analysis and is the correct way to explore differences in effectiveness by age group. There is no immediate evidence suggesting that the vaccine causes harm in older adults, so stopping the trial is premature. Selection bias could affect generalizability of the results, but this is not the primary issue in this case, so the focus is on analyzing the vaccine's age-dependent effectiveness. Question 19. A study is conducted to examine the impact of smoking on lung cancer risk. The researchers use a case control study design and find that individuals with lung cancer are significantly more likely to have a history of smoking compared to the control group. What potential confounder should the researchers consider, and what method can they use to control for it? Age, as older individuals are more likely to develop lung cancer and may have smoked for longer periods. They should adjust for age in the analysis. B. Alcohol consumption, as it may increase lung cancer risk independently of smoking, and they should adjust for alcohol use in the analysis. C. Diet, as certain dietary factors may affect lung cancer risk. They should adjust for dietary habits in the analysis. D. All of the above. The researchers adjust for multiple potential confounders to ensure an accurate analysis. Answer D. All of the above. The researchers should adjust for multiple potential confounders to ensure an accurate analysis. Explanation. When studying the relationship between smoking and lung cancer, there are several potential confounders that may distort the observed association. These include age, which influences both the likelihood of developing lung cancer and the amount of smoking over time. Alcohol consumption, which may independently contribute to lung cancer risk, and diet, as certain dietary habits may affect cancer risk. To obtain a more accurate estimate of the true relationship between smoking and lung cancer, the researchers should adjust for these potential confounders in their statistical analysis. Controlling for multiple confounders is essential in case control studies to minimize the risk of bias and ensure that the observed relationship reflects a true causal association. Question 20. A researcher is conducting a cohort study to assess the association between high cholesterol levels and the risk of cardiovascular disease (CVD). After conducting the study, the researcher calculates the hazard ratio (HR) for the association to be 1.8. What does this hazard ratio suggest, and what further steps should the researcher take to interpret the findings? A. High cholesterol is associated with an 80% increased risk of developing EE. The researcher should report the confidence interval and check for statistical significance. B. High cholesterol is protective against EE. The researcher should consider conducting a case control study. C. The study cannot determine causality. The researcher should perform a randomized controlled trial (ET). D. High cholesterol is unrelated. E. The research analyze the data using a different outcome measure. Answer 8. High cholesterol is associated with an 80% increased risk of developing EE. The researcher should report the confidence interval and check for statistical significance. Explanation. A hazard ratio (HR) of 1.8 indicates that individuals with high cholesterol have an 80% higher risk of developing cardiovascular disease compared to those with normal cholesterol levels. The researcher should report the confidence interval, assess the precision of this estimate, and check whether the HR is statistically significant. If the confidence interval does not include 1.0, this suggests that the result is statistically significant. Randomized controlled trials (RETS) are ideal for establishing causality, but cohort studies can still provide valuable information about associations. The hazard ratio suggests a positive association with CVD, not a protective, so the case control study is unnecessary. The outcome measure CVD is appropriate, so further analysis using a different measure is unnecessary. Question 21. In a study examining the effect of a new weight loss medication, researchers conduct a randomized controlled trial (RET) where the treatment group receives the medication and the control group receives a placebo. After analyzing the results, the researchers find a significant difference in weight loss between the two groups. However, several participants in the treatment group report adverse effects, including nausea and headaches. How should the researchers address these adverse effects, and what ethical considerations are important in this context? A. The researchers should report the adverse effects to the regulatory authorities and continue the trial without any changes. B. The researchers should analyze the adverse effects, compare them across groups, and consider modifying the trial protocol to ensure participant safety. C. The researchers should stop the trial for the treatment group due to the adverse effects, even if the medication shows positive results. D. The researchers should ignore the effects if the medication shows significant weight loss benefits, as the results outweigh the risks. Answer. B. The researchers should analyze the adverse effects, compare them across groups, and consider modifying the trial protocol to ensure participant safety. Explanation. In an RET, it is important to monitor and report any adverse effects, even if the medication shows positive outcomes. The researchers should analyze the adverse effects by comparing them between the treatment and control groups to assess whether the medication is safe. If the effects are serious, they may need to modify the trial protocol or even halt the study for further safety evaluations. Ethical considerations require that the researchers prioritize participant safety and informed consent. Stopping the trial for just one group is premature without further evidence, and ignoring adverse effects would violate ethical principles in research. Question 22. A study is conducted to evaluate the relationship between physical activity and mental health outcomes. The researchers find that individuals who engage in more physical activity report better mental health outcomes. But the study is observational. What potential limitations should the researchers be aware of when interpreting the findings? A. The findings may be confounded by unmeasured factors such as sleep quality or social support. B. The study's observational design means that causality cannot be established. C. There may be selection bias if individuals who engage in more physical activity are systematically different from those who do not. D. All of the above. Answer: D. All of the above. Explanation: in an observational study, researchers cannot establish causality, so they must be cautious when interpreting the results. The association between physical activity and mental health could be confounded by other factors, such as sleep quality or social support, which also influence mental health. Selection bias could occur if individuals who engage in more physical activity differ in significant ways from those who do not, such as having better overall health or social resources. Thus, the researchers should consider these limitations and interpret the findings as associative, not causal. Question 23. A hospital is conducting a study to compare two surgical procedures for treating a specific type of cancer. The researchers use a non-randomized cohort design where one group receives procedure A and the other group receives procedure B. Which of the following is a primary concern with this study design? A. Selection bias, as participants were not randomly assigned to the treatment groups. B. Information bias, as data on the outcomes may not be accurately collected. C. Confounding bias, as other factors may influence the outcomes besides the surgical procedure. D. All of the above. Answer: D. All of the above. Explanation: in a non-randomized cohort study, participants are not randomly assigned to treatment groups, which makes the study vulnerable to multiple biases. Selection bias may occur because participants in one group may differ systematically from those in the other group, e.g., based on severity of disease or other characteristics. Information bias could arise if the outcomes are not measured or recorded consistently across the groups. Confounding bias could also be a problem if other factors, such as age, comorbidities, or cancer stage, influence the outcomes but are not controlled for in the analysis. Thus, all of these biases must be carefully considered when interpreting the study results. Question 24. In a study investigating the relationship between high-fat diets and obesity, researchers find that participants who consume more fat are more likely to be obese. However, the study is cross-sectional. What is the primary limitation of this study design? A. The study cannot determine causality, as it only measures associations at one point in time. B. The study has a high risk of confounding, as unmeasured variables may influence the results. C. The study only includes participants who are already obese, making it difficult to generalize. D. The study is too short in duration to provide meaningful results. Answer: A. The study cannot determine causality, as it only measures associations at one point in time. Explanation: a cross-sectional study measures associations between variables at a single point in time, but cannot establish causality because it does not track changes over time. In this case, the study finds an association between high-fat diets and obesity, but cannot determine whether the diet causes obesity or whether obesity leads individuals to consume more fat. While confounding is a concern in any observational study, the inability to establish causality is the primary limitation in a cross-sectional design. The study does not only include obese participants, but it still cannot infer causality from the observed association. Question 25. A research team conducts a meta-analysis to combine results from multiple studies on the effectiveness of a new drug for treating a specific condition. The studies included in the meta-analysis are heterogeneous, with varying sample sizes, methods, and outcomes. How should the researchers approach this heterogeneity when conducting the meta-analysis? A. The researchers should ignore the heterogeneity and proceed with a fixed effects model. B. The researchers should report the heterogeneity and consider using a random effects model to account for variability between studies. C. The researchers should exclude studies that show different results from the others. D. The researchers should focus only on the studies with the largest sample sizes to ensure more reliable results. Answer: B. The researchers should report the heterogeneity and consider using a random effects model to account for variability between studies. Explanation: when conducting a meta-analysis with heterogeneous studies, it is important to acknowledge the variability between studies and use appropriate statistical methods to account for it. A random effects model is ideal in this context, as it assumes that the true effect size may differ between studies. With the heterogeneity in study designs, sample sizes, and outcomes, ignoring the heterogeneity and using a fixed effects model could lead to misleading results. Excluding studies based on their results can introduce bias and should not be done arbitrarily. Focusing only on studies with large sample sizes may lead to publication bias, as studies with smaller sample sizes may still provide valuable information. Question 26. A researcher wants to conduct a cohort study to examine the relationship between air pollution and respiratory diseases. They enroll a group of individuals with different levels of exposure to air pollution and follow them over time to track the development of respiratory diseases. Which of the following is a potential source of bias in this cohort study? A selection bias, as participants who choose to participate may have different exposure levels compared to non-participants. B. Recall bias, as participants may misremember their exposure levels to air pollution. C. Information bias, as the data collected on respiratory diseases may not be accurate. D. All of the above. Answer: D. All of the above. Explanation: several types of bias can affect cohort studies, including selection bias may occur if the individuals who choose to participate in the study differ from those who do not, potentially leading to unrepresentative exposure levels. Recall bias can affect the accuracy of exposure information if participants are asked to recall their past exposure to air pollution. Information bias could arise if the data on respiratory diseases are not consistently or accurately collected across participants. Therefore, the researchers must take steps to minimize these biases in the study design and data collection processes. Question 27. A public health study investigates the effectiveness of a new vaccine in preventing a viral infection. The study shows that the vaccine has an efficacy of 70%. However, the study was conducted in a highly controlled setting, and the vaccine's real-world effectiveness may differ. What is the most appropriate way to assess the real-world impact of the vaccine? A. Conduct meta-analysis of studies with different settings and populations to examine overall effectiveness. B. Rely solely on the controlled trials results, as they provide the most reliable information. C. Conduct follow-up study in real-world settings to assess the vaccine's effectiveness in diverse populations. D. Ignore the trials results and assume that the vaccine will be equally effective in real-world settings. Answer: C. Conduct a follow-up study in real-world settings to assess the vaccine's effectiveness in diverse populations. Explanation: while controlled trials provide important information about a vaccine's efficacy, the real-world effectiveness may differ due to variations in population characteristics, adherence, and environmental factors. To better understand the vaccine's impact in the general population, the researchers should conduct real-world follow-up studies that assess its effectiveness across diverse settings and groups. A meta-analysis could be useful, but conducting a follow-up study is the most direct approach to assess real-world effectiveness. Relying solely on the trial's results ignores potential differences in diverse real-world environments. Ignoring the results and assuming equal effectiveness is not a valid scientific approach. Question 28. A study examines the association between alcohol consumption and liver disease risk. The researchers find that participants who drink heavily are more likely to develop liver disease. However, some participants may have other conditions, e.g. hepatitis, that increase their risk of liver disease. What is the best approach to control for this potential confounder? A. Stratify the analysis by hepatitis status to assess the effect of alcohol on liver disease separately for each group. B. Ignore the hepatitis status, as it does not significantly impact liver disease outcomes. C. Conduct a randomized controlled trial to eliminate confounding factors. D. Focus only on participants without hepatitis to avoid confounding. Answer: A. Stratify the analysis by hepatitis status to assess the effect of alcohol on liver disease separately for each group. Explanation: in this study, hepatitis could be a confounder that distorts the relationship between alcohol consumption and liver disease risk. The best approach is to stratify the analysis based on hepatitis status, allowing researchers to examine the association between alcohol and liver disease separately for participants with and without hepatitis. Ignoring hepatitis status would lead to confounding bias, as the study may attribute the risk of liver disease solely to alcohol consumption. Randomized controlled trials are ideal for eliminating confounders, but this is an observational study and stratification is more appropriate. Focusing only on participants without hepatitis would exclude valuable information and reduce the generalizability of the findings. Question 29. A study on the effectiveness of a new antidepressant drug shows that the treatment group has a statistically significant improvement in symptoms compared to the placebo group. However, the researchers observed that participants who received the treatment were more likely to be from higher socioeconomic backgrounds. What is the primary concern regarding this observation, and how should the researchers address it? A. Confounding by socioeconomic status, which may affect treatment outcomes. The researchers should control for socioeconomic status in their analysis. B. Selection bias, as higher socioeconomic individuals may be more likely to participate. The researchers should exclude these individuals from the study. C. The improvement in symptoms may be due to the placebo effect. The researchers should perform an additional placebo-controlled study. D. Information bias, as socioeconomic status may influence how symptoms are reported. The researchers should ensure accurate reporting methods. Answer: A. Confounding by socioeconomic status, which may affect treatment outcomes. The researchers should control for socioeconomic status in their analysis. Explanation: Confounding occurs when a third variable, such as socioeconomic status, is associated with both the treatment and the outcome, potentially distorting the observed relationship between treatment and symptom improvement. The researchers should control for socioeconomic status. Their analysis to assess whether the treatment effect is independent of socioeconomic factors. Selection bias is a concern if participants from higher socioeconomic backgrounds are overrepresented, but controlling for socioeconomic status in the analysis can help mitigate this bias. The placebo effect could influence the study, but it does not address the socioeconomic confounding issue. Information bias may affect how symptoms are reported, but this is secondary to controlling for confounding variables. Question 30. A researcher conducts a randomized controlled trial, or ET, to assess the effect of a new exercise regimen on cardiovascular health. The trial finds that the intervention group shows a significant reduction in blood pressure compared to the control group. However, the study's follow-up period was only 6 months, and the researcher wonders whether the results will be sustained over time. What is the best course of action for the researcher? A. Conduct long-term follow-up study to assess the sustainability of the blood pressure reduction. B. Ignore the potential for long-term effects, as 6 months is sufficient to assess the intervention's impact. C. Report the results as conclusive and recommend the exercise regimen for long-term use. D. Conclude that the exercise regimen is not effective for long-term use based on the 6-month follow-up period. Answer A. Conduct a long-term follow-up study to assess the sustainability of the blood pressure reduction. Explanation: to determine whether the blood pressure reduction observed in the study is sustainable, the researcher should conduct a long-term follow-up study. While 6 months may provide valuable information on the immediate effects of the intervention, a longer follow-up period is necessary to assess whether the benefits persist over time. Ignoring long-term effects result in misleading conclusions about the exercise regimen's overall impact. Reporting the results as conclusive without considering long-term outcomes could undermine the study's validity. The intervention should not be dismissed as ineffective without assessing its long-term effects.